that's a really nice story, because aducanumab, was developed by Nietzsche and Hock in Zurich in Switzerland. And they had a fantastic idea. They looked on people, I think they were 90 to 100 years old, that had not got Alzheimer's disease. And then they thought, okay, these guys must have an antibody against this disorder, against something. So they took out antibodies from the blood prepared, so that it's already human antibodies. I mean, usually we produce antibodies in animals, rabbits, for example. And so it was a new idea, really. And then they went into clinical trials, and the aducanumab studies have passed into phase 3 trials, led from Biogen in Boston, Biogen in Boston. And then they reported a rather positive phase 1 plus study. And then they quickly jumped into phase 3 trials, 2 phase 3 trials, without actually having a proper phase 2 trial. And then there was, I think it was last year, must have been last year in spring. The 2 studies included a lot of patients, like 1,500-1,600 patients each. One was called Emerge, and the one was called Engage. And then they did a interim analysis in spring last year, and it came out a press release that they had stopped the development due to low to bad results. And they didn't say actually if it was the effect size on cognition or if it was too much side effects. So I don't honestly know that. And then later in the last fall, they suddenly announced that they should have, they reanalyzed or took in patients again and reanalyzed data, and in some way merged the 2 studies, at least because of the 2 studies, one had a rather positive effect, especially in the highest dosage group. It was up to 10 milligram per kilo in the patient. So if I would take over 1 gram, 110 kilos, and multiply that with 10 milligrams, and you get 1 gram, 1.1 gram once a month. It's an injection, an intravenous injection, that's certainly also, and you should then take that for the rest of your life. And then they presented the results at a meeting. We call it clinical trials in Alzheimer's disease, and it was high expectations on that because they had positive data in one and a bit negative in another. In one, they saw I think it was an improvement of more than 20% compared to placebo. And they measured this with, we call it the CDR sum of boxes test. And in the other, they had a bit negative data actually for the active approach. But when they combined, they took the highest dosage in that study that was negative and moved that together with the more positive study. And then they reanalyzed the data after some time. And of course, this is a completely new way of doing an analysis and bringing in good or bad things. But the outcome then was that they should go to the FDA and discuss a sort of limited approval or whatever it's called, restricted approval. But my own feeling was that the report contained several caveats, I would say. It was. We know from our experience here in Sweden that we see in the highest dosage many side effects. Patients get headache, they get problems. When you look on the MRI images, you see that they get an edema around the vessels. We call it ARIA-E changes. And these are in a real high frequency in the higher dosages. So that is certainly also observandum that is of clinical importance. And then, of course, it has to be discussed how this new approach is possible to accept. And I'm sure this discussion is ongoing. We need a drug, but we don't need a drug that has low effect and high side effects. So my personal feeling after having heard their rather good description at the TTAD meeting, and I think it was beginning of December last year, is that I think with that data they should be stimulated really to move into a new, properly done phase 3 trial. I think that would be the way. Otherwise, if they are in some way approved for it, then there should be other approvals for drugs that have been tested earlier that are really showing a bit of the same effects. But I think the data are, as you said, at least indicating that we have some effects if we can choose the proper patient and the proper dosage and avoid the side effects. And it's easy to say that these side effects are manageable, but in the clinical situation, they are severe for some of the patients. So I hope they will be recommended to do one more proper designed phase 3 trial. And I think they have got the possibilities to do this. They have really done a good job with the material they have and given us a lot of new knowledge this week.